Welcome. The Office of Programs to Enhance Neuroscience Workforce Diversity within the National Institutes of Neurological Disorders and Stroke is pleased to welcome you to this Open Stage monthly webinar series. This is our targeted outreach effort for our diverse neuroscience community to learn about NINDS programs and network with NIH and NINDS program staff. Each webinar, we feature a different program, division, or cluster with the goal of increasing the representation of diverse groups in our portfolio. This month, we are really excited to have such a big audience here. We're going to talk about neural engineering funding opportunities from NINDS. We're going to hear from program directors and some fantastic NINDS awardees. So before we get started, I just have a few housekeeping items. If you could send us the next slide, perfect. So a few meeting reminders. We are all going to be muted, so all attendees are going to be muted. Please submit questions using the chat function, and we'll keep track of your questions and answer them at the end. A reminder that this meeting is being recorded and we will transcribe and archive it on our website. You'll receive the slides, you'll receive a whole bunch of resources in a post-event email, so don't worry about any of that. Well, we've got you covered. You can enable closed captioning under live transcript at the bottom of your screen, and details again about where to find all this archived versions of our videos and resources will be on social media. It'll be on our listservs. We'll also send it all to you in an email. So please do stay connected with us. Feel free to email us if you have any questions about this webinar or the series in general. But with that, I'll pass it off to Dr. Sahana Kukke to get us started.
Thank you, Anna, Dr. Ibrahimi. It's such a joy to be here and to work with the Open Office on this webinar. My name is Sahana Kukke, and I'm a program director at the National Institute of Neurological Disorders and Stroke, also known as NINDS. And the portfolio that I manage here is on the topic of neural engineering. And my goal today really was to show you what kinds of research NINDS supports in neural engineering, and to explain a little bit about our programs and how we work, and introduce you to an excellent panel of researchers to hear a little bit more from them. So we are going to start off this hour with an introduction by me and my colleague, Dr. Eric Hudak, who's also program director in NINDS, and he will come on in a couple minutes and introduce himself as well. So the two of us will tell you a little bit about programs at NINDS. Then we will move on to panel presentations by our esteemed panel of researchers, where you can hear a wide array of experiences from awardees who have very different award types and in different fields of science that are all within neural engineering. And finally, we're going to leave a good amount of time to talk about your questions and hopefully answer them, or at least point to where you might find your answers in the future. So we welcome you. We're so excited to do this and look forward to connecting with you after this, and hopefully up at conferences and as things open up a little bit more and more. So first thing I want to talk about is what is neural engineering at NINDS. And I guess, generally speaking, it's bioengineering applied to the nervous system. Any research that is funded within NINDS has to fit the broad mission of the Institute, which is to seek fundamental knowledge about the brain and nervous system and to use that knowledge to reduce the burden of neurological disease. So whatever type of research you're proposing, if it fits within that mission, then it will fit within NINDS. Now, within NINDS, there are a great number of portfolios. And so what is neural engineering then? There are probably a million ways to explain it. And we have basically broken it up into these three bins. But as you think about them, you'll kind of think, well, wait, does that go into the other bin, or does this go into that bin? So it's just sort of a framework to think about, but not precise, I guess. But you can think about devices that interact with the nervous system. For example, neural prostheses, cerebrospinal fluid shunts, and brain-computer interfaces or brain-machine interfaces, however you like to call them. These are some examples of devices, or the development of these devices is research that we support. You can also think about techniques, for example, neuromodulation, neural repair and plasticity, nanotechnology, and novel biomaterials, all of which fall within neural engineering. And then translation. So we want to be able to see these devices and techniques actually get into use. So diagnostic and therapeutic devices, industry partnerships for technology development, and clinical trials. So these are some big buckets. And if you're interested in applying for a grant here at NINDS, and you have any kind of doubts or confusion about whether what you're proposing fits, then we have program staff like me and my colleague Eric, who you'll meet in a minute, to help you discuss what the boundaries are of NINDS funding. So when you are ready to apply for a grant, and possibly you've already applied and you've possibly already been awarded, you might already know this, there are funding opportunity announcements that we produce, which are basically the vehicle through which you apply and get funded. And I'm going to present this in a very simplistic manner, which is to explain two general types or two general classes of grants. One is investigator-initiated projects. So you have the ideas and you're bringing them to NINDS and saying, I really want to do this project. This includes parent announcements like the Parent R01, Parent R03, and they're really open and they're very general, so we can get your best ideas to come in. These are reviewed by the Center for Scientific Review, also called CSR, and they receive a priority score and a percentile rank. And once they are scored and the summary statements are released, the lowest percentiles are the ones that are most likely to be funded. So at NINDS for the fiscal year 2022, our pay line was the 14th percentile. And every year, our funding strategy is published on our website. So make sure you take a look at that, and you can just Google NINDS funding strategy and find out for that fiscal year, what is our pay line. So if you scored 14th percentile or lower, you're most likely to be funded. And there's a different pay line for early stage investigators, which we often call the nickname ESI, early stage investigator. The pay line for ESIs is higher, 25th percentile. And you can also search, within NIH on Google about the ESI, and that is 10 years since your last graduate degree. So that qualifies you for that category. Oh, excuse me. And the second class are special research initiatives where NINDS decides certain topics that we want to see more applications in. So we'll put out a funding opportunity announcement focused on special topics. And these can have very different styles. For example, they can be cooperative agreements, which are structured differently than research projects. They could be phased awards, which require some kind of evaluation and approval process to continue from phase 1 to phase 2. So there could be a lot more program involvement with those. And you'll have to read the entire funding opportunity to understand what the parameters are for that specific FOA. These can be either reviewed by CSR or by the scientific review branch within NINDS. And so the funding opportunity announcement will say that, will indicate where the review is going to take place. And then these will receive a priority score after review, but they may or may not be percentiled. So each of those special projects might have its own process by which the funding decisions are made. And you'll have to refer to that FOA, the FOA, or to the program staff member who's overseeing that program to get details on that. So going back to that first class, the investigator-initiated projects, I've listed out here a couple of the common ones. So there's the Parent R01, Parent R03, Parent R15. Each of these mechanisms has its own parameters. For example, the R01, the budget could be up to 5 years, whereas the R03 is 2 years and the R15 is 3 years. So each one has its own purpose. The R01, is probably the one that you're most familiar with. The R03 is great for tool development. It's a smaller project in budget and in time. The R15 is specific to certain eligible colleges and institutions, and I've listed two, the area and the REAP, and each of those is an acronym. So there's the Academic Research Enhancement Award is the area for undergraduate focused institutions. And then the REAP is the Research Enhancement Award Program for health professional schools and graduate schools. So I'm just putting all these numbers out there for you to take a look and see if that applies to you and whether you might be eligible. And then the last one I included in italics because it's not a parent R21, but it's the R21 that NINDS uses. So this is one that we have developed and we are working with NIMH on. And it is a 2-year award and it is clinical trials optional only. And then towards the bottom of the slide, I've included a little screenshot of our training and career development website, which is very helpful to find career stage-based funding opportunities so that you can look at those icons in the bottom left. Those are all clickable on the website. And when you do that, for example, postdoctoral fellows, you can click that and you'll get a lot more information that's kind of tailor-made for you if that's your career stage. So I encourage you to check out that web link. Okay, now the second class of funding opportunities that I mentioned was the special research initiatives where NINDS has some kind of focused programs. And here I'd like to highlight a number of them that cross divisions within NINDS. So the division that I belong to is the Division of Neuroscience. And we have 3 funding opportunities I just wanted to highlight to you that deal with the earlier stage development of tools and devices in engineering, concept generation, device development, and optimization, kind of dealing with this a lot of times preclinical engineering projects. This is mainly done through these mechanisms. So there's the NINDS Exploratory Research R21. This is the same R21 I just mentioned in the previous slide. There is a program that we collaborate with NSF on. It's the NSF NIH Smart and Connected Health Program. And there's a bioengineering research grant R01, which is being reissued and should be available in the coming months. So please reach out to me if you have any questions about that afterwards. In our Division of Translational Research, which is where Dr. Eric Hudak is housed, we have translational neural devices, and these are cooperative agreements that allow kind of moving devices out into clinical use and to help patients in need. And then we have the Division of Clinical Research, which has a number of clinical trials. So once a device might be ready to be tested in humans and in larger populations, we have clinical trials to be able to do that. And now I would like to turn this over to Eric Hudak to take us through the next few slides.
Hello, everyone. My name is Eric Hudak. I'm a program director in the Division of Translational Research at NINDS. And in our division, we support neural engineering by providing grant programs that facilitate the translation of neurotechnologies from laboratory use into clinical practice so that we can bring new therapies and technologies to patients who are in need. So in addition to the NINDS programs that Sahana talked about in the last slide, the NIH offers a variety of neural engineering funding opportunities across this device development pipeline from concept generation to clinical trials. These programs are offered through several NIH-wide programs, one being the NIH Blueprint program, another being the NIH Brain Initiative, and the other being the NIH HEAL Initiative. Next animation, please. The NIH Blueprint program is a coordinated effort across NIH to support neuroscience research. And recently, under this program, a new initiative called the Blueprint MedTech program was launched. And that program aims to support device development projects, as well as projects for the translation of novel neurotechnology into clinical practice to diagnose or treat conditions related to nervous system disorders. The next program is through the BRAIN Initiative. And in the BRAIN Initiative, that is a trans NIH program that seeks to accelerate the development and application of innovative neurotechnologies relevant to the brain and to the central nervous system. There are a variety of programs offered by BRAIN that span the device development pipeline, as you can see here. And these span from early stage technology development to device optimization and dissemination, and also to later stage projects for early feasibility clinical trials. The third program is through the HEAL initiative. HEAL is an acronym that stands for Helping to End Addiction Long-Term, and that is another trans NIH program, and this one aims to address the nation's opioid crisis through the development of new pain therapies and treatments for opioid use disorder. Through HEAL, we've recently launched several new programs to support the development of diagnostic and therapeutic devices, as well as translational studies for bringing new treatments to patients in need of non-addictive therapies for both pain and opioid use disorder. Next slide. So listed here are a number of additional NIH programs that support neural engineering research. The first one is the new NINDS Interdisciplinary Team Science Program, and that grant program funds interdisciplinary teams to pursue bold and impactful and challenging research in any area within scope of the NINDS mission. The second program is known as the Diversity R01, and that aims to support new investigators and at-risk investigators from diverse backgrounds, including those from groups underrepresented in the health-related sciences. The third set of funding announcements are geared toward data scientists, and they support the creation of both biomedical data repositories as well as biomedical knowledge bases. And lastly, the NIH-NSF Collaborative Research in Computational Neuroscience, or CRCNS program, is an international program that aims to support computational neuroscience research to better understand complex neurobiological systems. Next, we wanted to touch on data management and sharing within the NIH. Coming up soon in January of 2023, there will be a new NIH policy for data management and sharing that will be in effect. This new policy will apply to all NIH-supported research that results in the generation of scientific data, regardless of funding mechanism. So that's a significant change to what the NIH data management policy was prior to this date. And as part of these requirements, all applicants will be required to submit a data management and sharing plan in their application, which will outline how scientific data and any accompanying metadata will be managed and shared, taking into account any potential restrictions or limitations. And then as an applicant has their research funded, they will have to continue complying with the data management and sharing plan that was approved by the institute that funded them as the course of their project continues. More information on that plan can be found on the NIH website at sharing.nih.gov. In terms of rigor and transparency, we wanted to highlight this topic as it's very important to both NINDS and NIH overall. And we want to encourage you to consider these as you're composing your project plans and your applications. So at NIH, we define scientific rigor as the application of the scientific method to ensure unbiased and well-controlled experimental design, methodology, analysis, interpretation, and reporting of results. So when you're writing your application, please do consider rigor and transparency in all areas, including in your supporting data, your experimental design, minimization of bias, and in the reporting and interpretation of your results. Guidance on rigor and transparency is available on the NIH website at the links on the screen, and it also includes a link to the guidance from our NINDS Office of Research Quality, which focuses solely on this topic. As you're considering NIH funding opportunities or what type of grant you may want to pursue, you may be wondering whether NIH has funded other similar research in the past, or you may want to know which other investigators in the field are working on similar neural engineering projects or topics that you are. So there is actually a very useful tool on the NIH website that we wanted to highlight called Matchmaker, which you can access by going to reporter.nih.gov. And on that page, there is a Matchmaker text field. And in that field, you can enter any relevant information from your project, such as an abstract you're working on or any other scientific content. And when you click search, it will show you a list of all the NIH-funded research projects that are similar to yours. It'll show you the project's abstract, as well as the names of the investigators working on your grant, so you can get an idea of who else is working in the space. You can also search by program official to see which NIH program director hold those types of grants in their portfolios, which can also then lead you to knowing who to contact at the NIH regarding your topic of interest. So we wanted to summarize this section with some tips for success. The first one being to read the entire funding opportunity announcement you're considering applying to. The NIH funding opportunity announcements, or FOAs, can be very long and very detailed and a bit challenging to get through the entire thing, but we do encourage you to read through that. It contains all the very important information you'll need to be able to apply to the program, including upcoming application receipt dates. It also talks about who is eligible for the various FOAs to be able to apply. And this is particularly important for investigators who may be at institutions outside the United States. Various FOAs at NIH do accept applications from foreign organizations, but this does vary by the program, so it's important to review that material as well. For the review criteria, we highly recommend you thoroughly look at the review criteria listed in the FOA. This is the information that the review panel will use to judge and score your application. So you definitely want to make sure that you address those points in your application content. It also shows the points of contact at NIH at the bottom of every funding announcement. And that relates to this next section. We highly encourage you to connect with your program director and get to know them. You can do this by sending your specific aims page or a project summary and a bio sketch to introduce yourself. You can ask them which FOAs may be related to your research topic of interest. And once you apply to your program and have your application reviewed, you can also discuss your summary statement with your program director and discuss next steps. We also encourage you to get to know NINDS. You can do that by reading this fiscal year's NINDS funding strategy on our website, which talks about matters of pay line and other areas of research interest from NINDS. You can also watch the open session of our National Advisory Council meeting. The next one for that is actually scheduled from a week from today on September 7th, and you can view that live at videocast.nih.gov. And again, we encourage you to listen and subscribe to the NINDS podcast, Building Up the Nerve. There's a lot of really valuable information, and there's something for everybody in that program to learn about NIH and NINDS and all matters around grants and funding. So with that, I'll hand it back to Sahana.
Thanks, Eric. So I just want to point out that I'm sure you're all happy in your research careers, and we don't mean to distract you away from that. But just to also mention that there are career opportunities at NINDS. And so if you are interested in those, we have a few links over here that you can look at, and some descriptions of the different types of career opportunities we have in case you or your colleagues or trainees are interested. So with that, Eric and I want to thank you very much for coming and listening so far, but don't go yet. There's a lot more excitement coming. Before we move on to our panel presentations, I just want to let you know that we have our email addresses here on this screen, and we are happy to connect with you if you have questions. So please don't hesitate to reach out to us. We all know each other well here, so if I'm not the person to help you or Eric isn't the person, we can definitely get you to the right person. So thank you for listening. And now it is my great pleasure to introduce you all and to welcome the Neural Engineering Awardee panel. So our goal here now was to be able to showcase some of the researchers at NINDS who do neural engineering related research. And we have brought together a group of scientists who have gotten into NINDS through various different funding opportunity mechanisms. So hopefully there's a little bit in each of their stories that speaks to you. And I'm really excited to introduce them now. So our first speaker is going to be Dr. Ana Hernandez-Reynoso. She is a postdoctoral fellow at the University of Texas at Dallas. And at the moment, she has her research is being funded through a diversity supplement on an R01 award. After Dr. Hernandez-Reynoso speaks, we will hear from Dr. Kate Wofford, and she is a postdoctoral research fellow from the University of Pennsylvania. And she most recently was involved with NINDS through an F32 grant. After Dr. Wofford speaks, we'll hear from Dr. Lakiesha Williams. Dr. Williams is an associate professor at the University of Florida, and she right now is about to be awarded an R01, and she applied through the parent R01 mechanism. Finally, after Dr. Williams speaks, we will hear from Dr. Emery Brown, who is an Edward Hood Taplin professor at Massachusetts Institute of Technology. And he has also been he was also a previous council member for the NINDS. Dr. Brown unfortunately had one of his flights canceled that was supposed to be this morning, and it became this afternoon. So he unfortunately is not here with us live, but was very gracious to record his message to us all. And so we will see him by video, and hopefully, we all can follow up with him later with more individualized questions if we wanted to. So welcome to our panelists, and I will hand it over at this point to Dr. Hernandez-Reynoso, and thank you so much for being here.
Thank you. First of all, thank you for the invitation to join this panel. I'm really excited to be here with everyone else. And so my name is Ana Hernandez-Reynoso. I am originally from Mexico, where I actually studied biomedical engineering. The first time that I was introduced to neural engineering, to the field of neural engineering, was when I had the opportunity to do an exchange program at Georgia Tech. And I just happened to take the course on Introduction to Neural Engineering. And I was amazed. And at that point, I decided this is what I want to do. And of course, at the time, I wasn't entirely sure on how to do that. So after I graduated from my undergrad, I actually pursued a master's in computer science. And a lot of people ask me, why computer science? And my reasoning, at least, is that computer science is required for brain-machine interfaces, neural interfaces in general. So it was a really powerful tool for me to have that background and to be able to apply it to neural signals. So I graduated from that, and then I joined UT Dallas, where I actually did my doctoral studies in also biomedical engineering. And I was in the laboratory of Dr. Mario Romero Ortega. And we worked together in developing a novel technology, a novel therapy to treat urinary incontinence in women by using neuromodulation of peripheral nerve. After I graduated, I actually joined the laboratory of Dr. Stuart Colgan and Joseph Pancrasio here still at UT Dallas. But at this time, I decided to expand my neural engineering knowledge and focus on the central interfaces. So the current work that we are doing right now is we're investigating different strategies to try to prolong the life of recording neural devices. So microelectrode arrays, they tend to fail shortly after implantation. And so we're investigating mainly two strategies to try to make those devices last a little bit longer. And so this is where actually my diversity supplement came into play, because right now the ongoing studies is focused mostly towards the recording of neural signals. But my proposal for the diversity supplement was actually changing the focus a little bit and focusing on the stimulation of these devices. Now, these actually kind of leverage a lot of the skills that I learned during my doctoral studies, because they were also focused on neural stimulation. But now the difference is that I'm applying those to the central nervous system. And so one of the challenges that we have encountered, or not challenges, but one of the opportunities is we would like to assess how the detection threshold for stimulation in rodents changes as time progresses after incantation. So what we're working on right now is actually developing a new behavioral protocol in rats so that they can actually tell us, obviously not by speaking, but by the behavior, that they're actually feeling a stimulation that we're delivering to them. So that is the current protocol that we're currently developing. And so I guess that was my first official introduction to the NIH and the funding mechanisms and everything. And so up to this point, I have honestly been very excited, very delighted. It's obviously a lot of work. You have to think about all of the science and everything, put it into writing, make sure that it's clear for everyone to understand. But at this point, I am happy with, at least with the award that I have gotten this far. And I'm really looking forward to continue working, within the NIH programs and everything else that you have presented to us today. And I guess a little bit outside of, the academia world, I am also a volunteer. So I actually am part of the Big Brother, Big Sister program, where I actually have a little sister. She's a 13-year-old girl. And, me being a scientist or on the way to becoming a scientist, I actually try to introduce her also to the STEM field. And so we do some activities that involve some museums and then some other activities that involve biology and microscopy, et cetera, to try to get her excited to come and join this part of the lab or the science. And on top of that, I also enjoy swimming, and obviously, why not sitting at the hot tub at the gym and just relaxing from a hard day of research. And yeah, thank you so much for the invitation.
Thank you so much. Yeah, I like this feature where we can do the applause. Thank you. Okay, and go ahead, Dr. Wofford, you're next.
Sure, I also want to thank everybody for the invitation to present here today. I'm excited to be able to share some of my story so that hopefully others can help others navigate through this process. I graduated from Austin College, which is a tiny liberal arts school in North Texas with a double major in biophysics and psychology. And while I was an undergraduate, I was able to complete some undergraduate level research in a couple different neuroscience labs. And this taught me a couple things, but most importantly, it taught me that I loved learning about the nervous system, but I was particularly interested in questions or trying to solve problems in the nervous system. And so, as you can probably guess, this led me in the path of engineering. And so I applied to and then matriculated into the biomedical engineering program at Drexel University, which is a university in Philadelphia. And while I suspect that every PhD is challenging, I really enjoyed my experience because I was able to initiate an intra-institutional collaboration. My primary mentor was Dr. Kara Spiller at my home university of Drexel University. And I was able to reach out to a secondary mentor or collaborator, Dr. Casey Cullen, who worked across the street at the University of Pennsylvania. And so while Dr. Spiller worked on biomaterials, the immune system, and focused a lot on monocyte-derived macrophages, Dr. Cullen focused more on traumatic brain injury, tissue engineering, and biomechanics. And so their collaboration allowed me to have a thesis where I characterized neural inflammation in the brain after a traumatic brain injury. And then I invented a therapeutic treatment for traumatic brain injury. I loved this research, and so I wanted to continue in the field of traumatic brain injury because I find that there's a lot of research opportunities for characterization, diagnostics, treatments. And so I started a postdoctoral fellowship in the laboratory of Dr. Casey Cullen at the University of Pennsylvania, my secondary mentor from my PhD. And I chose to do this because he employs one of the most advanced preclinical models of traumatic brain injury that mimics the movement of a traumatic brain injury that would happen in a clinical case. And so I as I was entering into this postdoctoral position, I was awarded the F-32 for the proposal that I wrote. And this F-32 supported research thus far has been investigating the kinematics or the movement of these rotational traumatic brain injuries. And I've been using mathematics and statistics in order to describe their relationships and relate them to recovery. And so this is important because we envision that this could be used as a diagnostic mechanism. So what kind of interactions have I had with the NIH? Well, I skipped over this, but I actually applied for an F-31 in my PhD and was not selected for funding, but I learned a lot during this process. I learned about standard comments from reviewers, and I learned a lot about the writing that goes into a grant mechanism like this. And so when I applied for my F-32, it took me a couple months to write it, and I wrote it during the time of my dissertation. I was more prepared, I think, in submitting that application. Like it was suggested, I reached out to NINDS before I applied to make sure that my specific aims page was within NINDS's scope. And so that was awarded and has supported my postdoctoral fellowship. I also want to mention that last year I applied for a K99 R00 Career Development Award, and I just recently received news that that was awarded. And so I wanted to bring that up because it suggests that getting an F-32 doesn't preclude you from being eligible from subsequent funding. And so with that, I'd like to turn it back over to the floor.
Thank you so much, Dr. Wofford. Great to hear your story. Dr. Williams, go ahead. You can take it from here.
Sure. Thank you guys for having me. And in true professor form, I have a PowerPoint. So I'm going to share my screen, please. 1 second, it should come up shortly. Okay, good. Well, thanks for having me. I'm excited to be here. I'm Lakiesha Williams, as was stated earlier. I'm associate professor at the University of Florida. And I was just awarded an R01, which our team is extremely excited about doing this work. Just a little bit about my background. I showed this to show, specifically, I have engineering degrees. All of my degrees are in engineering, specifically, mechanics, biological engineering, which heavily mechanics background, my PhD in biomedical engineering, heavily biomechanics background. I started my career earlier years ago in the ag and bioengineering department, which was still very heavily ag, but still most of the students were biomedical. So I was able to use some of the biomedical principles. But also I've moved recently, 4 years ago, I guess it seems recent, to a biomedical engineering department here at University of Florida. So it just, this engineering background just allowed me, being in both a very clinical environment and prior to now, a very heavily mechanics and modeling environment, helped me to merge those disciplines especially well. So I started off in my career looking at TBI models, very similar to Kate. I know Kate's PIs fairly well. So I started off doing a lot of traumatic brain injury, blunt trauma, a lot of MR. And what you see here, that's what it is. We built test devices, all different types, and a lot of image analysis and things like that. And all looking at the brain, soft tissue to validate finite element models, which is what you see here. A lot of our finite element models were validated by some of this soft tissue models, soft tissue analysis. So heavily mechanics and modeling, a lot of computational work. We assess the skin, the scalp, the skull. We try to incorporate everything into these models, which we were excited and very successful in doing. But then as we got further into our assessment, we realized that there was something missing. We had safety mechanisms, we had helmets, we had all these refined tools, but we were missing something in the brain. We realized we were missing the dura, the meninges. So we started asking some very strong scientific questions about the meninges, about its importance in brain health and recovery from TBI and so on and so forth. And so in our lab, we started doing some experimental, some benchtop work on the meninges, and which is what my R01 is about. And in that, you can see here, this is the cranial dura matter here, and I won't go into depths, but this is, I think in the past, many scientists and engineers alike, we've thought that the meninges to the brain is like paint is to an airplane. And that's definitely not true. If you can see the integrity and the structure here. So we began to dig deeper and find out, ask questions. Okay, it's a structure, it has integrity. It also has some immune exchange, and it's on the brain. So we started thinking about a team of us who can come together and answer the specific mechanics question, answer the immunological questions, and answer the neuroscience and neurosurgery questions about the importance of the role in the dura, its regenerative properties, and so on and so forth. Just the whole aspect of attacking this question we had. And I just showed this here to show a survey was done in 2020. It was published by B, and they showed that there are lots of dura out there. And essentially, I showed this to show there's no clinical standard. There's essentially no standard. So our goal is to just assess the dura overall from different materials, whether it's homologous or composite or natural, and be able to quantify this mechanically, immunologically, and from a neuroscience perspective. So a team of us have teamed up, 3 of us, all PIs at the University of Florida, myself, Dr. Erica Moore, and Dr. Justin Hilliard. All of us have engineering backgrounds. We're all biomedical engineering by undergrad. Of course, Dr. Moore is in material science, Dr. Hilliard's a neurosurgeon, and myself focus on the engineering mechanics and the modeling of this material. So our thought process as engineers, which I extremely value, was the system, and we came together and brought together a team of people who can actually focus on the system. And this was our path to funding to NINDS. So again, I think this was said time and again, but take time to craft the idea. It took us years to craft this idea and to make it make sense. Send to a review team, my mentors, Dr. Moore's mentors, Dr. Hilliard's mentors, as well as send your aims to NINDS. We submitted, our first submission was non-discussed. That was 2 years ago, essentially. We addressed the feedback line by line and was really serious about approaching that feedback. And we resubmitted it. And our second submission was positively reviewed and funded. So it's really a good story. I would say my background in funding is heavily from Department of Defense. And so this was a new way of writing, a new approach. So it was just exciting to learn the NIH language and the way that they review proposals. And lastly, contact your program director. I can't say that. Dr. Kukke, you were very supportive of me in this process at the end. I just want to shout out to the people who's doing the work, my team, and I know I'm over time, so I'll keep going. And some of the things that they do that's very important to our lab, our hands-on demonstrations. We bring students in the lab to talk science. So all of these students over the next 5 years will hear a lot about Dura and what we do. And lastly, I just want to thank you guys for the time, and we're ready for questions.
Thank you, Dr. Williams. Just before we get to the questions, I want to share with you Dr. Brown's message for everybody. So let me get him 1 minute.
I want to thank Dr. Kukke for inviting me to be part of the Stage Zero Engineering webinar. I apologize for not being able to be there in person. So what I thought I would do is to share a brief synopsis of my career trajectory. I was an undergraduate at Harvard. I majored in 5 mathematics after switching from Romance languages. After I graduated from Harvard, I spent a year at Grenoble studying mathematics and also so I could improve my French as well, because I was studying Romance languages. I studied Spanish, I studied French, and I also studied Portuguese. When I came back from France, I did the MD PhD program at Harvard, did my PhD in statistics. That was quite a novel idea. No one had done a PhD in statistics before. I worked on circadian rhythms, but human and non-human primate circadian rhythms, and worked on characterizing their properties, developing accurate statistical models. And I realized in medical school that I liked anesthesiology, so I decided to pursue anesthesiology as that would be what I want to do for residency. So after I finished residency at National Hospital, I joined the faculty there. I started my laboratory doing statistical modeling, still circadian rhythms. At the same time, taking care of patients in the operating room. And I had two separate careers. My research had really nothing to do with what I like clinical practice. And so about 2 years into the faculty position, I decided that I should maybe get my research a little bit more focused. So what I did was I looked at the major areas that NIH was funding at the time, which was women's health, environment, genetics, cancer, and neuroscience in the brain. So I decided to switch formally to studying brain science. And I started working with neuroscientists, Matt Wilson in particular at MIT, to develop statistical methods to analyze neuroscience data. There were two problems they really needed to solve. They had to come up with better ways to characterize the dynamics in these data, and also specifically better ways to characterize neural spiking activity. And for one, I use state-space models for the dynamics and also learning process models for the neural spiking activity. And that got me into a lot of contact with neuroscientists and seeing how they use neuroscience to study phenomena. And I like behavior, the paradigm of systems neuroscience. So I realized that I could probably use this paradigm to study anesthesia. However, actually prior to doing that, I also taken a course in computational neuroscience at the Woods Hole Marine Biological Laboratory, so I could train in computational neuroscience better. And then actually for a number of years afterwards, once I'd sort of set up doing research in computational neuroscience, I actually taught a course with Partha Mitra and David Kleinfeld and statistics in neuroscience, which is called the neuroinformatics course. So with this very broad exposure to neuroscience, I realized I could use it to study anesthesia. Anesthesia was considered to be a mystery, a black box at the time. Nothing could be further from the truth, but we realize now is the drugs create oscillations that interrupt and impair how parts of the brain communicate. So I set up a research team that involved a broader range of people, neuroscientists, engineers, mathematicians, statisticians. They actually looked at the problem and the problem of what happens to the brain under anesthesia. We use human models, not human primate models, mathematical modeling, signal processing. And so now that's where our program is at the moment. We're studying better ways to improve anesthesia. And to make it more specific, we're looking at how we can develop better ways to control the brain under anesthesia. That's research that's funded by NINDS, how we can turn the brain back on after anesthesia. Even better ways to use anesthetic techniques to help people truly sleep. And as you know, anesthesia is used a lot for treating disorders such as depression. So there are two things that I would say, thoughts I'd leave you with. One is be confident in your abilities to learn the material, because you have to learn how to learn, because you're going to have to change what you work on as your career evolves. And the second thing is you should definitely pursue the things that you're passionate about, because that's where you're going to be most successful. And for me, with the Romance languages, I didn't throw them away. I traveled to Latin America or in Spain. I did my lectures in Spanish. I've lectured in French and France, and I still have to give a lecture in Portuguese. That's upcoming. So thank you.
Thank you again to all our speakers. Maybe next time when Dr. Brown joins us, he can give us his remarks in Portuguese. Well, it was so great to hear from all the panelists. I really appreciate your contributions and sharing your perspectives. It's such a rich group here. It's really wonderful to see a lot of common threads, but also how diverse the science is and what a breadth is covered within neural engineering. Thank you again so much for your participation and sharing today. Now it's time for us to turn the conversation over to the attendees to lead a little bit through questions. So I noticed that throughout there have been some questions in the chat, and I would like to now see whether any attendees have questions for our panelists and whether we can get a discussion going now. So please feel free to post your questions in the chat. And I can give you a couple of minutes to think a little bit about what you might want to say.
And while people are posting their comments in the chat or their questions. We did have one question come in that hasn't been answered yet. And this is more geared toward program staff at NIH, but I think we can quickly address it. It was basically around when you're looking at a funding opportunity announcement and there's a listed expiration date on that announcement, are all abilities to apply and resubmit to that gone after that expiration date passes? And what I can say is if you look at a funding announcement, and I'll put an example one in the chat right now, for a lot of our newer funding announcements, there is a table of application due dates listed, which is very helpful. And typically the expiration date for the funding announcement is the day after the final application due date. So after that date, you can no longer apply through that funding announcement, whether it's a new application or a resubmission. However, oftentimes for many grant programs, they're reissued under a new funding announcement number. And it's often possible for you to resubmit under that new funding announcement number, even though you applied to it an older version of the same program. That being said, it's probably always best to check with your program director just to make sure that you know when the final receipt dates are and what the possibilities are for resubmissions in the future.
It looks like we have a question in the chat. Oh, Anna, would you like to add to that?
No, I actually wanted to see if I could also ask a question myself.
Sure, of course.
Yeah, and so Dr. Kate Wofford, you mentioned about your K99 R00, and so I'm looking at actually submitting one myself here in the next few months. So I was wondering if you could, share some advice on how to write a successful application.
Yeah, I'd be happy to give you some advice. Start early. It is a big application, and get feedback from a lot of different people. Kind of like Dr. Williams was saying, reach out to your resources. I think that the reviewers in general really want to see that you are moving into a new direction that's very unique from your advisor, but that you can do that jump in a reasonable amount of time. So give them some juicy science, show them that you need to grow, and show them where you can grow.
Thank you.
So there's a question in the chat about how scientists can work on neural engineering projects internationally, and are there any specific research institutes, universities, or companies? What I can say is that there are often collaborations with international institutions in NIH awards. So it certainly is possible. Whether the applicant is domestic or foreign will be important to note, because some funding opportunity announcements will not allow certain institutions being the primary applicant. But within an application, you can have sub-awards that include other institutes and universities, and they could be foreign. There are kind of more strict criteria about inclusion of foreign institutions, and so it is possible, but you have to be thorough about justifying why that institution is required to do the work that you want to do. And I will put in the chat a website that you can refer to, which includes application and award information for international institutions, and hopefully that will help you further.
Could I add to that?
Please.
Yeah, so I don't have obviously firsthand experience. I mean, I guess so I don't have PI experience with that myself, but so during my doctoral studies, the project that I was working was supported by the NIH, and it was actually in collaboration with an institution in Mexico. And so one of the things that I took away from that collaboration, one, communication is really important. And second, for it to be successful, we actually had to have a lot of agreements, not only in terms of which portion is going to be done by whom and all of that, but also we set up a lot of SOPs, standard operating procedures, so that we knew that both labs were operating under the same strict and rigorous science. And So I think that was a key component for it to be successful.
Thank you. And now I see a hand up. Harina? I'm not able to hear you. Oh.
Okay. I managed to unmute myself. Thank you very much for taking my question. In your recent comment, you mentioned the academic institutions from other countries. And my question specifically is, how does that relate to the industry and academic collaborations? Like if the industry is in US and the academics are in Germany or India or wherever, and vice versa. What are the rules relating to this cross international collaborations? Did I explain my question?
I think so. Yeah, and I think I can try to explain that. And if another program staff member would like to add, that would be fine too. I think it is very difficult for me to make a general comment because each funding opportunity announcement is crafted in its own way, depending on where the funding is coming from and what the priorities are for that funding group. So the most I can say and the best I can say is whatever funding opportunities you're looking for to look for what that specific one will allow. It's not that there's a blanket expectation across all of the funding opportunities regarding this kind of collaboration.
I do see one question in the chat. I think we can start to address from Parth Modi. It says, for a practicing clinical neurologist interested in neural engineering, what ways or projects can I get involved? And I think it kind of varies depending on your situation. I think, like we mentioned during the presentation, you can take advantage of the matchmaker function on the NIH website to find people working in this space. We don't typically actively support matchmaking between investigators from the NIH side, but I would encourage you to sort of make those connections through your institutions or your communities and try to identify other people working in this space. Also available on that reporter website, it's actually a database of all NIH funded research. So you can even search by nearby institutions or your own institution to see who else has been funded from NIH. Specifically in neural engineering. So I would take advantage of that. But if others on the panel have experience with sort of making connections and making connections either from neuroengineering to clinicians or vice versa, that might be useful as well.
I would second what you said. Most of our clinicians have come from, of course, within our institutions, which we've just had to personally reach out to them and make those connections, especially the ones who are heavily in clinic. So, but they were excited about doing research. So I think I would second exactly what you said.
I see Maria you have your hand up.
Yes, thank you. It's a follow-up. This is Maria Gonzalez from the University of Houston. Thank you for this. This is following up Anna's question about the Ki-99. So I really want to share in this forum that for the Ki-99, I just submitted one and didn't get it, but I was in borderline. But I realized that something very important is the mentor team. So the mentor teams should be strong and ideally from different institutions. But not only that, the mentor plan should be even stronger than in other grants. Why? Because this is a transition grant. So they really need to get involved in your project and match your specific aims and the plan that they will have to get you reach the transition. So that's really important for that. So all the comments I got, it was very sad because it was not about my project, it was about this plan around the project, around your transition. So thank you.
Thank you for sharing that. And there is one more question in the chat that is addressed to all the panelists. Thank you for sharing your time and experience. And how did you all approach the writing process for K or F grants? Did you have a specific strategy? And maybe I can start with Kate, if you have a response to that.
Sure. The way I approach writing is I'm a big outliner. So I start with a really big outline and go through a lot of iterations, trying to think about experiments that are exciting and then cutting things that aren't going to fit into the story as well. So in general, I start by writing my research strategy. And at the same time, in parallel, I wrote my candidate info and career goals. And those went together because the studies that you propose should be married to the types of techniques that you already know how to do, but also the types of techniques you're going to propose to learn. And so building those up together at the same time worked for me. And then at the very end, once that research strategy, candidate info, and career goals had been finalized, I finished off with the equipment, facilities, research summary, those other smaller documents. So that's how I approached it personally.
Thank you. Lakiesha, would you like to add to that?
Yeah, so I didn't do a K or an F, but I would say for the R's, exactly. I would say I focused mostly on just, again, we spent years on crafting this, but focusing on, again, our approach, our team, what we needed, and then just refine the approach. And from there, we went to the other sections. But yeah, I would say outline's the best way to do it, and have people look at parts of your grant, people you know and trust, and go from there. So I would second what Kate said.
Thank you. And Anna, would you like to add on that too?
Yeah, so obviously the diversity supplement is not the same as the Ks or Rs or any of the previously already talked about. But for me, I actually had a proposal that I had submitted for another fellowship for my postdoc that I unfortunately didn't get. And so it was curious because for that proposal, it was just a one-page proposal, and then there was a bunch of other requirements. So when I started writing the proposal for the diversity supplements, I actually started something that already had like something of a structure, and I started writing from that. So I took that sort of like my specific aim page, and then I started with the research strategy. However, after I finished writing the research strategy, I went back to my specific aims and realized, oh, this makes no sense anymore. So I had to rewrite almost the entire thing. But I guess one of the things that, you know, I had already written something, and so I didn't start from scratch when I started looking at the diversity supplement. I actually built upon something that had failed, and so to make it actually more slightly more successful. So I think my advice is it's an ongoing process.
Thank you. It's always nice to hear from multiple people the same question, because you see the diversity of responses too. So are there any more questions from the attendees for our panelists or for our program staff here today? Hopefully this is the first of many conversations. We are, some of us might be at Society for Neuroscience. I don't know if you are all planning to go. I am going, and I would love to see as many of you as possible. That is going to be a nice opportunity to build communities again and start networking again after a pretty long time of some distance. But I hope this is really just the beginning of a longer conversation, and you feel that you learned something, or you were reminded of something. Please remember that we are here at NIH to answer questions for you. And you also have a great community of peers who are going through it with you. So thank you all for coming. Thank you so much to our panelists. I really appreciate hearing your perspectives and your stories. And thank you to the Open Office for hosting us. I'll hand it back to Anna Ibrahimi in a second. Eric, did you want to say anything before we turn it over to the open office?
Just one thing that came up in the chat at the last minute. We do have a listserv related to neural engineering topics. We can include the link and the information to that with the information that is sent out after the webinar. Thanks all for coming.
All right, wonderful. Well, thank you so much to our speakers, our panelists, and our program staff. This was a really great session. Thank you all for attending live. Again, as you know, this is recorded, so we will be posting the recording on our website. As Dr. Hudak just mentioned, we will send all of the resources, all the slides to you very soon in an email. I just wanted to end very quickly and let you know that this is a webinar series. So if you are interested, I'm going to post in the chat. Our next open stage is on September 28th, which will be a clinician scientist clinic, where we'll share funding opportunities for clinician scientists like MD, PhDs. Thank you so much again, and see you next time.